Hi, everybody. Judy Seeger, your host of the Ozone Therapy Summit, back again with another episode. And this episode is right up with everybody else. We're so happy to have Dr. Lina Garcia, holistic biological dentist, with us today. Dr. Garcia, thank you so much for being on here today.
My pleasure very much.
Yes, we have had a little bit of technical challenge, but we pushed through and made sure that we're here because you have a lot of things to say that is a little bit different with biological dentistry, and I really wanted to get you on the show. So thank you so much for your time. Yes. And Dr. Garcia, you have been a dentist for, over 30 years now?
Yep.
Yeah, over 30 years. So those of you who are watching, again, thank you for being on here. Appreciate you as well watching. Understand that every single expert we have on here is 20 years, 30 years, a long time, lots of experience we're bringing to you. So this episode is no exception. Dr. Garcia is right up there with knowing so many things, so many aspects of biological dentistry, and right from the start. So many times, Dr. Garcia, experts start out conventional and then go into alternative therapies, but you got a little bit different story. So can you share a little bit about how you got started in this whole holistic dentistry?
I'm from Brazil. I was born in Rio. And cultures have a big impact on what you do, how you do things. And Brazil is a more open mind culture where back in the days we had acupuncture, you had homeopathics, you had just taking a little tea for this. My mother is so into leaves and what the leaves can do. So I think I grew up in a different culture where things are a little different. And so when I went to, my uncle's a physician, my father ran hospitals, and I don't recollect as growing up lots of drugs at all. So if we felt bad, we would make chicken soup, or we ate a lot of organ meats. So the culture has influenced me to be more open-minded. I decided, even though the family had physicians and my father ran hospitals, I decided to go through dentistry instead of medicine. And I'm so glad I made that choice, because it's been like the mouth became for me the doorway into people's bodies, and has worked marvelously to be a dentist. And when I graduated from dental school, I was very blessed to work with Dr. Olímpio Faisal, which is a cosmetic dentist in Brazil, very well known, people coming from here and all over Europe to see him in Rio. And back then, over 30 years ago, he was mercury-free dentist. And he actually introduced Dr. Hal Huggins into mercury-free. And so he had all Weston Price's books in his library at his office. And I used to go there in between patients and dissect those books and read everything that was there to be read about natural medicine and how the mouth connects to the rest of the body. So that was my beginning in dentistry and medicine. And my uncle, as a physician, he was an anesthesiologist. But he wrote books too, because I wrote a book, and back in his days, he wrote a book about natural medicine. So somehow I really turned much more into that side of medicine, and we have what we have today.
Yeah, that's excellent. And you're right. Culturally, in Brazil, South America, many are actually parts of the world, there's more of a natural approach to it. And here in the U.S., unfortunately, it's not well known, but we are trying to get the word out about that. So, Dr. Garcia, you then decided to add ozone therapy to your practice, and tell us a story about how that came about.
That's a good question. It seems to me that it's been there forever. And so about 20 years ago, I worked in a practice in Chicago where actually there was introduction to ozone. And I decided that should be part of what I was doing. And it just started to grow and grow to a point nowadays that I don't do anything without ozone. It goes from restoring teeth to all the surgeries that I do, cleaning teeth or periodontal disease, whatever it's there to be done. ozone has its place in my practice. So there's fresh ozonated water every morning. Again, it doesn't matter if I'm doing a simple filling or a non-lay, an inlay, or sometimes a crown. We ozonate everything, the tissue around it, the teeth. I try to use less and less bonding and what helps to bond the restoration to the teeth. And ozone works to substitute that because bonding has toxicity into it. Even if you buy the biological ones, the ones that will be approved in your biocompatibility test, even them, I do not very excited about using at all. So ozone serves a purpose to everything in the practice. I think the capacity of the ozone to even help with bonding, it's a phenomenal thing. Everything, I don't care. Sometimes I'm even doing a tooth and then I look at the skin, and if there's an acne or something in my patient's face, I will help with ozone. And to start this interview, I want to just give an example. I had a patient last week, which actually it's a very well-known person. I won't mention his name here now, but he's a patient, has been a patient for 20 years. And he came in yesterday to do some dental work, and he had something in his foot that he stepped on when he was walking. He asked me if I could help him with that. I said, of course, let's gonna check it out. So he took his shoe out, and it was a big lesion with cellulitis actually around it, very inflamed, very red. I went in there, I incised it, I cleaned everything, and I put ozone inside the site. And the next day I got this beautiful email telling me that I think you just avoided me from ended up in either in a hospital or not being able to do the trip that he's scheduled to do tomorrow. And this is unbelievable. So he pursued more ozone when he went back home. And this is a solved case where most physicians, I would say all physicians, including a lot of even holistic people and your conventional people or hospitals or clinic, would definitely put him on IV antibiotics or oral antibiotics, just at least. And nothing. Ozone did the job. Ozone does the job. It's just a matter of adding that to your practice or as a patient, requesting that to the doctor you're working with. You can do insufflations that goes in every space in the body, ear, nose, vaginally, rectumly, in the skin. It can be used in the water. It can definitely be used in so many different ways. And I was in a meeting in Cuba a couple of years ago, and they do have in their hospitals, they use in every practice, and perhaps because obviously they have more of a social medicine establishment, they can afford spending too much money, and ozone does the job, and it's much healthier with no side effects. So why not? Why not every practice, even naturopath or chiropractors, dentists, physicians, hospitals, clinics, even at home. And
we're talking about that. We're going to be teaching people about using the home unit for sure. But I want to step back just a second, Dr. Garcia. You had mentioned about you use it in every aspect of your practice in dental work. So how does it work? And especially, we always have people on here who have know somebody on a cancer healing journey, and they're worried about what else can they do to bring their level up to the next step so that they could heal faster. So let's talk a little bit about how ozone can help people like that who have serious conditions and that connection in their mouth.
Health is a puzzle. There are different parts of this puzzle. I am a big fan, and I have 2 chapters in my book in regards to that, but nutrition is a basic part of this puzzle. So we highly recommend, especially cancer patients, autoimmune issues, you name it, from more advanced situations to simple situations, prevention for that matter. Ozone can be used in different forms. To answer your question, since health is a puzzle, we definitely have to address nutrition. Nutrition is a huge thing, and everybody's different. So there's no one nutrition fits it all. But I am very supportive of more raw one can do besides vegetables and some fruits, but carpaccios and ceviches, whatever raw one can do, because then you save a lot of digestive enzymes. And so if you're dealing with inflammation, cancers, whatever it's in the body, least work for the digestive system and more absorption of healthy nutrients, healthier that puzzle become. So that's one part of the puzzle. The other part of the puzzle is, of course, movement. People have always to be moving. Sitting down or being more sedentary definitely does not help. So even if one is sick and they cannot do too much, just walking or standing up, it's always very important for all this lymphatic movement in the body. Then you go into things that you can do at home. I'm very supportive also of meditation, prayers, whatever calms down the mind. If the mind keeps going, your immune system will be more challenged too. So calmer one is, or more skills they developed through meditation or contemplation, prayers, better they can deal with the immune system being stronger. And then, of course, coffee enemas. I'm a big fan of coffee enemas because it's something people can do at home. Between eating well, meditating, walking, doing coffee enemas at home, and having an ozone machine is a huge part of self-healing. Of course, if you are in a situation like you asked in regards to cancers or autoimmune problems or any other issues for that matter, you have to have a good team of people, because better nutritionists, better physicians, dentists, people that are more open-minded, they will guide you better with this puzzle of health and give you better tools so they can help you at their practices, and then you can do those things at home, that it's going to be much more financially reasonable for people. And they are totally a must part of this puzzle of health.
Right.
So,
and you know that you're saying what every expert has been saying on these interviews, and nobody knows what you're saying versus everybody else, but the viewer will see this pattern. Everything has to be together. It's not just ozone therapy, although we, of course, are teaching how powerful ozone therapy is. The nutrition, the exercise, the meditation, everything is together.
yeah.
And then having a team that supports you. So thank you for saying that. That's exactly what we're teaching here, that we want to give the whole picture here. Dr. Garcia, let's go into some specifics in your practice as a dentist, because people want to know, in your experience, what have you seen ozone therapy especially beneficial for when people have, let's say, periodontal disease or root canals, cavitations? Can you explain a little bit about what you're seeing as far as how the ozone therapy is helping those things?
We do lots of surgeries, remove of root canals, some cavitations, or even people that are not ready to remove their root canals, but they do have chronic infections on those root canals. Sometimes young people, you want to wait for their jaw to develop before you even suggest extraction sometimes. So it depending on the patients, you can always help with ozone, because ozone changes the acidity. So when you have a chronic or an acute infection, when you inject ozone in the area, either inside of the tooth or in the surrounding tissues or bone, you are changing that activity, you're changing the acidity. Therefore, you're eliminating pathogenic microorganisms, and you're creating a better area for healthy bugs to grow. I always go back to microorganisms because at my practice, we have a microscopy, and I'm really attentive to what patients have in their mouth when we take this sample. And if they have yeast, whatever they have in their mouth, it tells me a little story there. And it tells me how we can help them in the next year, in the next 5 years, to shift that. Because when we think of flora, we have to think the flora in the mouth, the flora in the gut, the flora in genital areas, in your skin. And how those floras communicate with each other is what definitely will create health. So if the health in the mouth, if the flora in the mouth is healthier, then the gut flora will be healthier. So as they communicate is what established health. So in the mouth, by simply injecting ozone in an area where one has a chronic root canal infection or cavitation infection or periodontal disease, once you inject ozone, you're again changing that acidity and you're making it easier for healthy bugs to grow and pathogenic bugs to decrease and die.
Dr. Garcia, as you bring that up, I know this comes up in emails to me. They are always looking, well, how do they change the acidity in their body, in their mouth? And you mentioned about the flora. So let's define, first of all, what is flora? And then how do we make it healthier in our mouth?
Flora is the bugs you have in your body, right? So it's like forests. We have all those forests in our bodies, and how they communicate is what dictates health. In the mouth, a healthier flora will be one that we don't use any metals at all, even if the biocompatibility test supports some form of metal or even gold, which is never a pure metal, even titanium. Everything that comes out of this periodic table that turns into this colorful metal color, we don't use because of what it facilitates for microorganisms. So in my practice, from implants to crowns, to inlays, onlays, to restorations, to partials, everything we do, it's towards the ceramic side. It's something that even the zirconia implants that we offer in our practice, remember, zirconia also comes like titanium, but the way zirconia is processed, it turns into a non-galvanic material, as the opposite from titanium. So once you change the flora, then you make it easier for healthier bugs to come into place. One thing that everybody has to remember is that microorganisms are on target. Different from humans. They don't eat too much. They don't drink things that are not supported to our hydration and health. They don't stress too much. They are so on target to evolve and become even more pathogenic and perhaps healthier too. We humans, we waste so much time with everything. There's a lot of work to try to convince people to eat better. It's a lot of work to try to convince people that medications are not what they should be adding to a long-term health. So all those factors microorganisms, they don't have that. They're on target. They don't waste time with anything. But our light, in order to keep our health and to support our health, it becomes trickier. And even things that are out of our control. Yes, we have control what we eat, what we place in our mouth, the practitioners we work with, but we don't have control over the environment. We don't have control over the Wi-Fi that keeps getting faster and faster. And our biological system is not ready to negotiate with that. We're not ready for all the pollution and the water challenges. There's a lot of challenges that eventually we can genetically and metabolically adapt, but it takes longer than the technology has developed and gone. So we are trying to catch up, and I don't know, we don't have that availability of time to catch up as much as all those interferences.
And so therefore, and so therefore they need help to get the flora back into balance.
Yeah.
They need, and so therapies like we're talking about the ozone therapy really helps that a lot.
Absolutely.
Yeah, I'm agreeing with you totally. As a naturopath, I don't see that we could get ahead of the game anymore. Used to be years ago, but not anymore. We need help. And that's why we're teaching about the ozone therapy. So just to shift a little bit, so we're talking about the flora and how important that is, and the ozone therapy, of course, helps that. as far as cavitations, that really is a big issue, especially with people with serious diseases. And you have also some, I noticed on your website, you have some teachings about how we need to take care of the bone structure and that. So can you teach us a little bit about what else you do to get the bone healthier and how you use ozone therapy for that?
It all goes back, and I'll be very repetitive just so people can get it. It takes at least 3 times, right, for us to kind of...
Sometimes more if we're a little bit slower.
I hope 3 times at least, but it could be way more than that. But having, being ready in your bag of tools to deal with any toxicity, any problems you have. Having ozone, having the coffee enema available to do is one that it's a very important thing. And having a machine. I don't know if what you guys offer, what you guys have, but when I was in Cuba,
teaching on that, sure, yeah.
There is some machines that I don't sell it, but that people can get it for $300-400. But it has to be with the oxygen from a tank. It has to be the medical grade oxygen. Doing it from the air, it's not appropriate when you're doing insufflation rectally or vaginally or ear and nose and different things. So for the bone and for the gums, it's essential that one is eating well. I mean, inflammation is the precursor for all the trouble we see. When you eat according to your metabolic tendencies and what's best for you in different phases of life. A pregnant woman is not the same as a premenopausal woman or a man that's going through surgeries or stress or whatever. So we all have different times that we must adjust what we are doing as far as nutrition. But better we eat, drier, less inflammation we have in our system, which is essential for any healing, preventive or acute diseases or all the other things we've been talking about. And for the bone, good nutrition. The other thing that could be very helpful is doing oil pulling. It's a tablespoon of sesame seed oil, which I support sesame seed oil because the little research that has been done around, it's the original recipe and it's the best one. A lot of other people will sell or mention other oils. Oils have different functions, and sesame seed is an ideal one for the mouth. Doing oil pulling, which there's a chapter in my book or in my website, you can get information on that there, but it's very simple. Just take a tablespoon, put it in your mouth in the morning or any time of the day for that matter, and swish around for 10 to 15 minutes and spit it out, swish around with a bit of salt water, and it opens up the pores and eliminate a lot of the toxicity that's sitting in there from microorganisms. The mouth is a part of your system that healthier the mouth is, everything else will be healthier.
And I just right into that, how are you seeing the connection with the mouth and the rest of the body? And I always ask the dentist that because this is not spoken about very much. People don't understand how important each tooth is, the health of the tooth, and how it's connected to the organs. So can you explain that in your words, how everything is connected?
Well, the mouth is a doorway to the rest of the body. So when I do a little bit of a microscopy in the mouth, when I see what patients have, what kind of metals, what kind of root canals, what kind of periodontal issues that they have, it tells me what tendencies and weakness they might have. So what I mean by interferences, if patients have metals, titanium, all sorts of different crowns with metals, and many times people think, oh, I don't have any metals, because they place this ceramic on top of those crowns, and they don't know that the whole underneath part of those crowns are actually metals. And you can see that in the x-rays. So metals, periodontal disease, all those things create this environment, again, for pathogenic microorganisms. So in my practice, when people come in, either we do that elimination of interferences at once, or it can take a year. It depends how time-wise, financially, they're available, but slowly but surely, we change the environment. It takes, I start with the gums and the bone. If there is pockets and bleeding, that's not normal. Bleeding in the mouth, it's a disease, it's an inflammation. We can't just accept that because our parents bled and they told us that was okay, not a big deal. It is a big deal. You don't bleed out of your skin for no reason. It has to be something stuck in there, or it has to be an inflammation or an infection. And
is that the same with when there's bleeding gums when they brush their teeth?
That's called a disease. It's a periodontal disease. We can't just accept that, because that kind of environment is harboring tremendous amounts of billions, trillions of very pathogenic microorganisms. And they are excreting toxicity that gets into our bloodstream. If the blood is available, if you can bleed, that means that's whatever that toxicity is getting access to the bloodstream and getting into your joints. So people could have rheumatoid arthritis or all sorts of arthritis or inflammations in the body coming from microorganisms in the mouth.
So is that the same with, so this is important, and that's why I'm just cutting in a little bit, Dr. Garcia. You're saying the bleeding in the gums is showing that there's a sign of something going on in the body and then in joints. Are you finding particular teeth as well connected to specific organs that there's a connection that's causing the disease?
So now we're talking about a meridian, the path, the acupuncture points in the body. And we have that in our website too. So if you go in there and you put a tooth in there, it will show you what that tooth is related to other parts of the body. So for instance, if you get a premolar, it will be related to your breast. So then you got to think, if someone is diagnosed with breast cancer, they must look back to the mouth and see what kind of tooth in my mouth is compromised because it's dead or has an infection or has a metal crown or a metal implant. And if that tooth,
so it could be any of those. It could be root canal, could be infection, could be any of those.
Excellent.
Not just because I've always heard as a naturopath, it's just root canal causing or connecting with the breast cancer, but you're saying could be many things.
Could be many things. Fortunately, also we are seeing more oncologists, neurologists, psychiatrists sending patients because they know that the mouth has this toxicity, even psychiatric issues, emotional issues, so many issues that has to do with microorganisms. More toxicity and more of an environment we allow in our bodies for microorganisms to develop and grow, more possibilities of all sorts of inflammation, infections, cancers.
So have you seen people actually, when you've cleaned it up and done your magic, to me, it's always about what you guys do. You get in there and you clean it out and you're using the ozone and getting rid of the infection. Do you see people getting out of your chair and feeling the difference, or does it take some time before they see the difference?
That's a good question, because I always tell my patients, patients don't like to come to dental office, right? They're going to be numb. There's a big needle. They don't like that. But I always tell them, I'm so excited you're here because we're making miracle happen today. And so they look at me and go like, okay, sure, try. But I do feel like that. I do feel that when we take those infections out, that you're giving the body a new chance. When we're taking mercury out, it's silly to have mercury, to have amalgam fillings. It's something that in hospitals, they put suits to clean it out. And here, the American Dental Association and different associations are supporting the use of this most toxic neurotoxin in people's body, children's bodies, pregnant women. So there's no common sense. If you really look deep into what conventional medicine and sometimes even holistic medicine supports. So we have to take a step back and as consumers, as patients, as practitioners, be aware of the unfolding of this process, that it's so slow. And you follow money and you see what's happening. Why so many vaccines? Why so many drugs? Because that's what makes money. as humans, we have to take a stand. We have to be aware. But for that, that's going to come back to the basics, which is eating well, sleeping well, eliminating, meditating. We have to do something that the thoughts and all the stress does not take over us. Because if that's the case, our immune system goes down and we are so much more available to those pathogenic microorganisms to develop and run the show, that we are not in control because we're not mentally clearly, we're not metabolically clear. So all those parts of this puzzle will support that. Yes, I do see patients sometimes take an infected tooth out, they're like, oh, wow. And it's totally true and very humble from my part to be so grateful for that, because people can feel that even when you take the mercury. Other people might take a while. It depends on the patient.
Depends on the patient, for sure. And then with mercury, let's just go into that a little bit deeper. You said you take out the amalgam fillings, which contain the mercury. And maybe we should cover a little bit about the dangers of that. And then what do they see, or how do you deal with it? Do you do ozone when you're taking out the mercury? How does the ozone fit into that?
So the ozone fits after you take all of that. Remember, and a lot of people will support oxygen during removal of mercury. I worked, of course, Mercola, Dietrich Linhart, so many of those people that have been in this field for as long or longer than I have. And one thing as a dentist that I always was very attentive is not to open up the brain barriers at the moment where you're taking mercury out.
Okay, so what does that mean, first of all? That
it's taking oxygen, for instance. So if people put oxygen, Hal Huggins had that protocol. I don't agree with all his protocols, even though I worked with him for many years and he was actually introduced by my mentor. But I tend to create new, because as I hope that young people that are coming to be holistic dentists and environmental biological people in the next 5-10 years, they're going to bring better stuff than what I am bringing now. It's always a matter of evolving and creating better ways of doing things. So of course, in my face now, I'm creating a better protocol. Ones in the future that are going to create better. It's not that I missed something. It's just because we're evolving. And that's what microorganisms do, right? They evolve. They become stronger. Nowadays, if you get some very pathogenic bacteria in your body or something, there's no even antibiotics. Hospitals are very limited with all of this. The whole world is very limited. So that's why we have to keep evolving so we can deal with microorganisms better. So again, when I take mercury out, or when I take any toxicity, any interference out of the body, you can only imagine that the body is going to keep getting better. So at the time that I'm doing it, I cover their faces. I have tons of different suctions around the patient, right? So we can protect the patients, we can protect the staff. I can protect myself because I've been doing this long enough. And obviously I want a safe environment for all of us involved in the process of helping patients. We use masks. Now, when the mercury is taken out, mercury is a very neurotoxic metal. It's well known. It causes a lot of brain fog. I have one video just on that. They're short videos. It will enlighten all of you in root canals and everything. So I'll let you go in there and kind of get more details on it. But once we take the mercury out, we clean the teeth. We rinse with different herbs and chlorella and different things. And then we do the ozone. We disinfect everything with ozone, and then we do the restoration, whatever the restoration might be, a simple filling or an onlay, an inlay, a crown if they came in with a crown. I'm not a big fan of ever cutting enamel. So I even the ceramic work that I do, it's very conservative, because I don't think as the best dentist we can substitute what nature has done, and that's that enamel. Enamel is the hardest structure in the body. God took his time, and he was very wise when he was building all the beautiful parts of a tooth. And for us as dentists or surgeons think that we can do much better. I don't think so. So I'll stay in my humble side where if I do not have to take that part of that tooth out, I leave that in. And then I ozonate everything, I clean everything, and we'll then add a ceramic work or filling, something that then will give structure for chewing.
So the ozone doesn't specifically go in after the mercury. It cleans it up to make sure that there's no infection and make sure that everything is balanced and the pH, everything in the mouth is all set. Yeah?
Yes, exactly. So many times we do a rinse before the procedure. And then after the procedure, we go about using the gas. Okay. Because there's different forms, right? You have the gas, you have in water, you have in oil, and you can use those different types depending the procedure you're doing, or you can only send patients home with the oil. Everything else does not last much. You gotta be redoing our water throughout the day to make sure it's ozonated and it's effective.
Okay, so we have so much to talk about and we have no more time. So first of all, Dr. Garcia, let's talk about your website where people could reach you. I know your practice is in, I believe, Chicago, Illinois, yes?
South Barrington, Illinois, yes. Okay.
And so what is your website that people at least could go there and learn more?
I got to reach out because I want to show you my book.
Okay, yeah.
Cleaner Teeth, Longer Life, what mainstream medicine doesn't know or won't tell you. So this book, it was forwarded by Dr. Mercola and Dietrich Kleinhardt, which have been part of their work, and they've been part of my work for many, many years. And he has chapters here that will really help the layperson, also practitioners, chiropractors. I work with a lot of chiropractors, naturopaths, more and more oncologists, more and more psychiatrists, neurologists, as I mentioned earlier, people that need, in order to have their protocols working, they need people to have better floras in the body. And the mouth flora being healthier will just make their life and their protocols and their advice much easier for them.
So Dr. Garcia, you would recommend, because I teach this all the time as well, you would recommend that if people are going through a healing journey, whether it's cancer or autoimmune, that they have a biological dentist such as yourself, a chiropractor, a nutritionist, a team to help them, to support them, and each one has their specialty. That would be ideal.
Exactly. I do work with an osteopath too. I'm trained osteopathically myself, and hands-on osteopathy is a huge part of our healing process too. Chiropractors, naturopaths, they all have their own ways to help that patient to sustain and support healing. Very interesting how you interview as a patient, as a consumer, the people you want to work with. One thing that I see a lot of people, they talk a lot, but they don't walk the talk. I am a big fan of people that walk the talk, so they eat impeccably. My staff will tell you, oh, she walks the talk. I do, because I want to be inspiring for people. I want to eat well. I want to do all the good things. And you still have challenges. But if you didn't do all those good things, then you would end up like your neighbors and family members. And because everybody follows the same cultural expectation that cancers are okay, medications are acceptable. No, they're not. We can do it different. And I am a Latin, stubborn doctor that I want to inspire all of you to find the way, and the way will show you what healing is all about.
Exactly. That's really well put. Thank you so much. That's powerful. That's exactly right. You are an inspiration, Dr. Garcia. Thank you so much.
I want to give you the website.
Yes. Oh, and the website name is?
Dr. Lina Garcia, LinaGarcia.com.
Yes, we will have this. We will have this in the resources. Don't worry.
Yes,
we'll make sure we'll have it.
I'm always kind of not clear. I have enough websites and emails, but anyways, yes, look it up for me, please.
We will definitely have it there. So thank you so much, Dr. Garcia, for your time, for your wisdom, and for your inspiration that you're truly leading us by your example and by your teaching. That's very helpful and motivational for all of us. So thank you so much.
And thank you for your time. I know this is our second time, and you hang in there like, I gotta get this done.
We work 24/7 to get this information because our mission, you and I and the rest of the speakers here, is to truly help people go to the next level in their healing, not just with ozone therapy, not just with detoxing, but all the things we're talking about, nutrition and their mental, emotional, spiritual aspect. All these things are very, very important. So
but I would say though, that without ozone, I wouldn't be the same quality dentist that I am today. Ozone.
Wow. So there you have it, watchers and viewers.
I don't use antibiotics. I don't use anti-inflammatories. I need ozone. I need something to fight those very smart on-target bugs.
They are smart. You're absolutely right. And people need to know that they evolve and they jump ahead, and we have to be ahead of that.
Thank you.
The ozone therapy is the one thing this is why I'm doing this. The one thing that I see kills it on contact. I mean, it's amazing how ozone therapy.
All of those microorganisms, not just bacteria, but virus, yeast, all sorts of parasites.
The pathogens that don't belong there. Absolutely.
Absolutely. Thank you so very much to you too.
Thank you so much. And those of you who are watching, appreciate you as well. And stay tuned. We have many more experts here on this summit. We will see you at the next episode. Thank you.